So if Brett and I are going to go to Radio City Music Hall, we apparently have to go before 12:40 Eastern Time because you can now see that the lights are out. Wow, really? Okay. Good to know. Look at it. The lights have gone dark in Radio City Music Hall. The Rockettes have gone home. And yet we are still here reporting the news for you. That's how much we love you, America. So now that the shutdown is over, the debt deal is done, we can turn to the healthcare question. And if you missed it, some of the country's biggest media outlets have recently become some of the biggest critics of the rollout. The Chicago Tribune recently writing a piece about, quote, why Obamacare is a mess. The Washington Post saying, quote, Federal Health Exchange sending confusing enrollment information to insurers. And this from the New York Times, quote, from the start, signs of trouble at Health Portal. Joining me now, Leslie Marshall, a Fox News contributor and radio talk show host, and Lars Larson, who is host of the radio talk show, The Lars Larson Show. Good to see you guys again. So the Washington Post talks about how the number of visitors to the healthcare.gov website fell 88% in the first 13 days, while less than half of 1% of the site's visitors successfully enrolled. It fell 88%, the number of visitors, and less than half of 1% have actually successfully enrolled. I mean, in most businesses, if that were your track record, your boss and you would be having a very unpleasant conversation, Lars.
Well, Megan, look at this. You shouldn't be surprised by this. An awful lot of the people, the first week that the Democrats were trying to say were just hopeful Obamacare signups, were actually showing up to be looky-loos. After 3 years of talking and $1.4 billion sunk into this mess, of course people are going to be curious about what's there. But once they got there and discovered that it was a technological nightmare, that the site isn't working, that you're not getting the kind of comparisons, and for those, I guess, fortunate few who got through, they found out it offers up plans that are demonstrably worse than what they have already. They're going to pay much higher deductibles. They're going to pay much higher premiums. And for the 20-somethings, it's a scam. Here's what they're doing. They're going to tell a 20-something, an otherwise healthy person, pay us a couple of $1,000 a year. The deductibles will be so high, you'll never actually get anything out of the policy, and we'll take all that money and we'll pay for other people's health care with it. What smart 20-something would sign up for that kind of disaster?
Leslie, how exactly do they plan to enforce this individual mandate when the people who are trying to sign up for it can't even get on the site? I mean, you're going to tell people you have to pay a penalty unless you buy this insurance. And they're going to come back and say, I didn't have all year to sit on your website to sign up for it.
I cannot disagree with that point, Megan. I do predict, my prediction here would be there would be some kind of an extension, whether it's 30 days or 60 days, until all of the computer glitches are in place. But Lars, to your point, the individuals that are signing up are people without insurance. And it's very common for somebody in October to look at something and then to go into a system in December and to sign up. Here in the state of California, I checked. I pretended I was something and someone other than I was, a lot younger and not married with 2 kids. And quite frankly, if I were to go to an HMO like Kaiser versus Obamacare, I save hundreds on Obamacare. And what am I getting? I'm getting insurance. And if I have no insurance, I have no way for prevention. And all I can do is wait till I'm in critical crisis mode, healthcare-wise, and go to the emergency room.
But I don't know if
which
that's
is what
the experience.
made us need reform in the first
because
place.
Mark Thiessen, who comes on our show, wrote a very interesting piece in the Washington Post, and he talks about how, according to an analysis that was performed by the Chicago Tribune, 21 of the 22 lowest price plans offered on the Illinois Health Exchange have annual deductibles of more than $4,000 for an individual.
Yep.
$4,000 for an individual. These are people who don't have insurance, probably because they can't afford it, because most people who can afford it would like to have insurance. So it's a $4,000 deductible and $8,000 for family coverage. And then plans that have the least expensive monthly premium, they're talking about deductibles $6,300 for individuals and almost $13,000 deductibles for families. I mean, who can afford that, Lars?
Megan, I've got to tell you, this is one of the critical distinctions you have to make, and we've been trying to make it to people for the last 4 years back into the discussion of this bill, when we didn't know what was in it, but we had to pass it. We've been saying there's a difference between health insurance and health care. A lot of those 20-somethings and even 30-somethings who can't afford it, and now definitely can't afford this more expensive Obamacare, and with premiums going up all around them, they already have health care in this sense. When they get sick, they go to the emergency room. They don't pay because they don't have the money to pay and they don't have insurance. And the hospitals write it off and the rest of us pay more. That's been the system. The idea is that Obamacare is going to get them to sign up, pay a couple of $1,000s, and as you point out, the deductibles are so high, they'll likely rarely reach them. Some will reach them. The other scary thing that's just come out tonight is that if you read into the Obamacare application, it says you have no expectation of privacy and that any of the information you put into it is accessible by federal, state, and local authorities. So when the local water district wants to find out about Leslie or whoever she's pretending to be on the website right now, they can actually access this. And Megan, you're a lawyer. This is written into the fine print like one of those, computer license agreements. Put all your data in here and we'll give it to any government agency that walks around.
I'll give you the last word, Leslie.
Bottom line is, Lars, whether it's a marriage, it's a business, or it's national health care, you've got to let it start and run before you criticize it. I know it's killing you guys, that it might actually work out, but talk to me a year from now when people are insured and they have preventative care, we're a healthier nation, and we're not cramming the emergency rooms. I think that's going to be better for America. Let's let it happen and talk in a year.
All right. Thank you both.
Thanks, Megan. Thanks, Leslie.